Let's talk about what causes chest discomfort, focusing on the most common and most important reasons. Almost 40% of people will experience chest pain at some point in their lives. Fortunately, most cases are mild and temporary, accounting for around 70% of cases. Most commonly, chest discomfort is due to musculoskeletal issues, often related to physical activity or poor posture. Another common cause is gastrointestinal problems like acid reflux or indigestion. Psychological factors such as anxiety and stress can also cause chest tightness and discomfort. In some cases, respiratory infections like bronchitis can lead to temporary inflammation and discomfort in the chest. However, chest discomfort can sometimes be life-threatening and requires immediate medical attention, as in the case of a myocardial infarction heart attack. That's why it is crucial to first rule out the following three conditions. First, myocardial infarction. Second, other cardiopulmonary causes like aortic issues or lung conditions. And third, non-cardiopulmonary causes. When chest discomfort is serious enough for a patient to seek medical attention, in 15% of cases it is due to a heart attack. In 5% it may be due to other cardiopulmonary causes. However, the majority of cases are still due to gastrointestinal issues. Missing a myocardial infarction diagnosis is dangerous because if a patient is discharged without treatment, the risk of death doubles within 30 days compared to those hospitalized. And myocardial ischemia is one of the most important and common causes of chest discomfort. It is called angina. Myocardial ischemia occurs when there is an imbalance between the heart's oxygen demand and supply. If ischemia lasts more than 20 minutes, a heart attack or myocardial infarction can occur. When chest pain happens during physical activity but goes away with rest, it is called stable ischemic heart disease. If chest discomfort worsens suddenly due to a clot in the coronary arteries, stable angina is usually triggered by exertion, cold, or stress and generally lasts less than 10 minutes. On the other hand, unstable angina occurs at rest or with increasing frequency. A myocardial infarction causes chest pain that lasts more than 30 minutes. People describe heart-related pain as pressure, tightness, squeezing, heaviness, or a burning sensation, usually felt behind the breastbone. Pain may radiate to the neck, jaw, shoulders, arms, and sometimes into the upper stomach. It's another condition. Pericarditis can also cause chest pain. It can last for hours to days and may be episodic. If the pain is sharp and pleuritic in nature and lasts for hours to days, it may be pericarditis. The pain is often relieved by sitting up or leaning forward, and a friction rub may be heard during auscultation. Pericarditis is the inflammation of the pericardium, the sac surrounding the heart, usually caused by viral infections or occurring after a myocardial infarction, known as Dressler syndrome. If chest pain is caused by aortic problems such as aortic dissection, the pain occurs suddenly and is severe, unrelenting pain. The person experiences a tearing or ripping sensation, meaning the pain is exceptionally intense, as if something is being torn apart inside the chest or back. This thing is located in the chest or back and often radiates between the shoulder blades. The person may lose pulse, have low blood pressure, or experience syncope called fainting. The major risk factors of acute aortic syndrome are high blood pressure and connective tissue disorders like Marfan syndrome and Ehlers-Danlos syndrome. Aortic problems are extremely dangerous. For example, after an aortic dissection type A, if left untreated, the risk of death is 50% within 48 hours. The treatment is emergency surgery to repair or replace the damaged aorta. Another critically important condition that causes chest discomfort is pulmonary embolism. It occurs when one of the pulmonary arteries is blocked due to a blood clot that has traveled from the deep veins of the legs. The pain occurs suddenly and is pleuritic, meaning it is sharp and worsens with breathing. Sometimes it can be very heavy pain, usually located on one side of the chest. The hallmark of this condition is shortness of breath and difficulty breathing. Other symptoms include a fast heartbeat, low blood pressure, anxiety and sometimes fainting, Severe cases of pulmonary embolism are life-threatening, and if left untreated, the risk of death can reach 30%. The treatment includes anticoagulation, using heparin-direct oral anticoagulants to prevent further clots, and in severe cases, thrombolytic therapy or surgery. Catheter-based intervention, known as embolectomy, may also be used. Another important condition is pulmonary hypertension, which means elevated pressure in the pulmonary arteries, causing strain on the right side of the heart. The person feels a gradual onset of symptoms, usually noticed during exertion or physical. The pain is pressure-like, resembling angina, and is usually located substernally, in the center of the chest. The person may also have jugular venous distension, swelling in the legs, and an enlarged liver due to right heart strain. In advanced cases, the person can have a bluish discoloration of the lips and skin, called cyanosis. If left untreated, pulmonary hypertension is life-threatening and has a poor prognosis. The treatment for pulmonary hypertension includes vasodilators, such as prostacyclins, endothelin receptor antagonists, and phosphodiesterase inhibitors. These medications help dilate pulmonary arteries and reduce pulmonary artery pressure. Diuretics are used to manage fluid overload. Oxygen therapy is crucial for patients who are hypoxemic. Pulmonary hypertension usually develops in people with chronic heart disease or those with chronic obstructive pulmonary disease known as COPD. Another important cause is pneumonia and pleuritis. Pneumonia is a lung infection caused by bacteria, viruses, or fungi. The pain is pleuritic in nature, meaning it is sharp and worsens with breathing. In mild cases, pain may be absent. The pneumonia is often localized to the side of the lung affected by the infection. A productive cough is common, along with fever, chills, and shortness of breath. On auscultation, rails may. Pericarditis, also known as pleurity, is inflammation of the pleura, often due to infection. The pain can vary but is typically acute, sharp, and worsens with deep breathing, coughing, or movement. It is usually one-sided. A dry cough is common, and a pleural friction rub may be heard during auscultation. If the infection is bacterial, in both cases, the treatment is antibiotics. Supportive care such as oxygen and hydration is crucial. Early treatment is key to avoiding complications like pleural effusion or emphysema. When chest discomfort is not caused by cardio or pulmonary causes, it is often gastrointestinal. The most common cause is esophageal reflux. The pain is typically a burning sensation, lasts around 1 hour, sometimes less, and is located substernally or in the epigastric region. It worsens after a meal and is relieved by antacids. Esophageal spasm is another cause, where the muscles of the esophagus contract abnormally, leading to chest pain or discomfort that can mimic heart-related conditions like angina. The pain usually lasts up to 30 minutes. Symptoms are often worse after meals and can be relieved by antacids. This condition can also cause dysphagia, which means difficulty swallowing. A peptic ulcer can also cause chest discomfort that usually lasts for 1 hour or more and occurs after a meal. The pain is commonly relieved by food or antacids. Chest pain can also be neuromuscular. For example, costochondritis causes an aching pain located around the sternum. Tenderness at the joint increases when localized pressure is applied. Cervical disc disease can also cause pain, including aching and numbness, which may radiate to the arm and shoulder. The pain worsens with neck movement. During trauma or strain, the pain is constant and aching in nature, usually localized. As pain increases with movement or palpation, psychological conditions can also lead to chest discomfort. For instance, during a panic attack, a person may feel tightness and shortness of breath, especially retrosternally behind the breastbone.